Hello and welcome to Health Matters, coming to you on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. A woman is said to be experiencing the menopause when she stops having periods and can no longer get pregnant naturally. This is sometimes associated with unpleasant symptoms. Usually periods come less frequently than they used to, and this happens over a period of months or years before they stop altogether. Sudden cessation is not a usual occurrence. The menopause is part of the natural aging processes in women, usually occurring between the ages of 45 and 55. My guest on the show is Kehinde Okunade, Dr. Kehinde Okunade. Dr. Okunade is a lecturer of obstetrics and gynecology at the College of Medicine, University of Lagos, and an honorary consultant of obstetrics and gynecology at the Lagos University Teaching Hospital. He's a fellow of the National Postgraduate Medical College of Nigeria and the West African College of Surgeons. You're welcome to the program, Doctor.
Thank you for having me.
Now, this menopause, what really is happening inside the body? Now, you said that the periods stop, but first of all, medically, how is it determined this woman has now become menopausal?
Okay, thank you for the question. The most important, first and foremost, menopause is a universal and mandatory event.
Every woman must pass through it.
Yes. So right from the time a woman is born, you are programmed or destined, maybe so to say, to experience menopause. And the age, of course, menopause is said to have occurred in a woman that has failed to experience menstrual flow for up to 1 year duration.
1 year is
1 year, yes. But of course, there are a series of events that leads to this. First and foremost, the woman probably will experience some degree of menstrual irregularity. The cycle length, that duration between one period and another, may become shortened. Usually, a woman's cycle length is usually about 28 days. But sometimes it can be less than 25 days when a woman is about to undergo menopause. That period that leads to the actual menopause, we call it menopausal transition, or what we call climacteric period.
Okay.
So it's the transition between when a woman is between the period that a woman has the reproductive potential to when she is no longer capable of having any reproductive potential. So basically, what leads to that inside the body, because it's the depletion in the number of follicles in the woman's ovary. When a woman is born, of course, right from the time of conception, a woman is programmed to have a certain number of follicles in her ovary.
These follicles, are they potential eggs? What are they?
Follicle is the seed where the egg is contained in the body. So, of course, when a woman is conceived, there are a certain number of follicles in her ovary.
Yes.
But as she grows older, of course, the number of follicles get depleted. Of course, you are going to menstruate every month, follicles are recruited, some of them are wasted, but at a particular point, usually between the age of 45 and 55, that period, that particular follicle is completely depleted. That is when a woman has attained menopause, because the follicular count is completely shut down.
Is there something contained in this follicle, like a certain sort of hormone or anything, that is aiding these periods to come regularly?
Yes, the follicles are responsible for the hormones, what we call sex hormone. These hormones are what, especially estrogen. The most important of them is estrogen.
But other hormones are involved?
We have progesterone, we have inhibin, but the most important of them, which makes a woman feel beautiful, we call it the hormone that makes a woman feel beautiful with herself. That is estrogen. But with depletion of follicles, of course, that is the source of estrogen. Estrogen level also gets depleted, and that is what results in all the effect that we see in all the body when it comes to menopause, with regards to what happened with the brain, the cardiovascular system.
Okay, before we go there,
so
let's talk about some of these unpleasant symptoms that the women have. What are these symptoms?
Okay, the effect of menopause is multisystemic and can be multidimensional. it is not every woman that will experience
these symptoms. Okay, so some will just quietly pass through.
Some will quietly pass through. The rate of report of menopausal symptoms, of course, vary from region to region. In this part of the world, it is hardly reported. But when you look at the advanced world, where they have, of course, women are not, they have good facility. I mean, they have access to efficient healthcare service delivery. They report. And of course, here in this part of the world, where you have to pay for healthcare out of your pocket, women hardly come forward to report such symptoms. But such symptoms sometimes can be, can adversely affect quality of life.
Okay.
And one of them, of course, is what we call, they can have what we call vasomotor symptoms. Vasomotor symptoms, the most important of them all. And it accounts for about 75% of all cases of symptoms that you see in menopausal women. Vasomotor is otherwise called hot flushes.
Okay, so it has something to do with our blood vessels.
Yes, hot flushes, of course, it has something to do with the blood vessels, especially, of course, but it originates from the brain.
Okay.
Because of lack of estrogen. There is an instability of what controls temperature in the body. So a woman feels a generalized sense of heat. So the heat sometimes can be unbearable, sometimes. In which case, of course, they can also experience some degree of night sweat, some daylight sweating, excessive daylight sweating. But these are due to the effect that the lack of estrogen has on the part of the brain. That part of the brain is the hypothalamus, and that is where the thermoregulatory function.
Very limited ability to control temperature now.
They are not able. I mean, of course, the body is trying to control it, but the way it is experienced, like they feel an abnormal sensation of heat inside them, and usually commoner in the face and in the neck. So it's so much that some women will not be able to sleep in the night.
Okay, sleep.
Some of them will lack concentration. Of course, it can lead to loss of energy. Because when you don't sleep in the night, of course, there's loss of energy, there's loss of concentration, and some other effect that I'll say with it.
Do they, if you look at the screen, I have some things written there. Okay. Depression, anxiety, irritability?
Yeah.
Probably because she couldn't sleep well.
Like I said, the effect of menopause can be multi-systemic and multi-dimensional. I've only mentioned one of them, which is the effect on the skin. That is the cutaneous manifestation.
But I'm interested in this weight gain.
Yes. With menopause, some women, they eat a lot.
Okay.
Some of them are not able to, of course, the rate of metabolism also goes down because estrogen is also responsible for how they metabolize some of the energy in the body. So they accumulate a lot of fat and so on and so forth. So that there is some weight gain.
There's talk also of loss of bone mass. Is that correct?
Yes, that is the musculoskeletal effect. It's one of the most dreaded effects of menopause, because what happens basically is that there is what we call loss of bone mineral density. Of course, there is what we call bone weakness. The bone becomes weak in such a way that it is prone to fracture. So, and when it's, of course, sometimes too, because it is weak, you can see some individual, they have what we call the stoop. They have a stoop posture.
As you get older, they start to bend.
And the height also gets shorter. Because this estrogen effect, lack of estrogen effect, affect the long bones in the body. So you see, and of course, you see severe low back pain in some people. Okay,
I have this question now. If lack of estrogen is causing loss of bone density and the stoop, do men have estrogen? Why don't they bend? Is there something else men have that is keeping their bones straight?
Okay. Of course, men have an event that is likened to menopause. We call it andropause. But the effect of andropause is not, it's because all these changes that you see, of course, starts much more earlier in a man, and a man is able to cope well with it.
Oh, I see.
But there's a transitional period for a woman, which is why sometimes the effect, because of course you are used to the effect of the hormone, you are living beautiful, but when there is a stoppage of this, of the source of this hormone that makes you feel beautiful, of course the effects sometimes
they are more devastating than in the man.
Yes, than in the man.
Now you've spoken of what is happening in the body. Are there any other consequences, like other systemic consequences of this menopause?
Yes, like we've mentioned earlier, of course, there can also be cardiovascular effect, hypertension.
So estrogen is like a stabilizer of the whole body, then?
Yes, that's just the right word to use. That's the right word to use. Of course, there can be coronary artery disease, because Basically, what happens is that such women are prone to what we call atherosclerosis.
Okay.
Atherosclerosis is a disease of blood vessel because, of course, there are some lipids in the body that estrogen helps to regulate. We have lipids in the body that are cardioprotective. They protect our heart. There are some that are dangerous for our heart. So what estrogen does is to make those ones that protect us higher, and those ones that are deleterious for our health lower. But of course, when estrogen store is depleted, basically what happens is that those ones that are dangerous to us, they become higher, and those ones that are protective become lower.
Okay. Yeah. Now, of course, one of the risk factors for menopause is being a woman, and then definitely being older. Yes. But are there other risk factors?
Well, basically, if I'm going to talk about the risk factor, let me quickly talk about what are the different types of menopause. There is normal physiological menopause.
There are different types.
Yes, there's a normal physiological menopause, usually occurring between the age of 45 and 55. That is normal. But when it occurs before the age of 45, we call it early menopause. That can be as a result of some other factors that can affect, that can cause early depletion of these follicles, which is the source of the estrogen we are talking about. There can also be what we call premature menopause. Premature menopause is usually categorized as a pathology, as a problem, as a disease, because it means the menopause occurring before the age of 40. And of course, there can also be what we call late or delayed menopause, if it occurs after the age of 55. So,
is that good, occurring late?
We usually don't, because
women would like that.
Delayed menopause, not many women like that. Delayed menopause sometimes has its own effects on some other parts of the body, on some other disease condition, basically. So we prefer to have a normal physiological menopause taking place. So, like looking at the question you asked earlier, what are these things that can make a woman experience menopause much more earlier, vis-a-vis early menopause or premature menopause? Such condition can be genetic. So, for instance, if your mother experiences, her own menses, stoppage of menses very, very early, there is a 6 times risk of the daughter of that woman experiencing menopause early
as well,
compared to the normal general population.
Hereditary component.
Yes, there are also chromosomal abnormalities. There are condition we call Turner syndrome. There is a condition we call Fragile X syndrome, and so on and so forth. There are also autoimmune conditions too. For instance, we have autoimmune thyroiditis, because it means the body is producing some antibodies that fight its own cells. So antibody can be produced by a woman that will be fighting her ovary. So it can cause a depletion.
Off all those,
yes, so it's an autoimmune condition. Then of course we have environmental causes, we have medication, of course surgeries too. If a woman has had surgery, they've removed her womb. Of course, while they are removing the womb, they will tie some vessels. Of course, such vessels are supposed to supply the ovary. When they are not supplying the ovary, our follicles die early.
Okay. So let me put a pause to it there and take a quick break. Okay. Please stay with us. We are coming back right after this.